People in general, they are suitable. Most of the people are suitable for dental implants. However, people who are very young or very, very old wouldn't be really very suitable candidates, or people who are having certain medications, like for example warfarin, which causes a lot of bleeding or something. We have to control the amount of bleeding, or people who have drugs that interferes with the bone itself, like for example Fusamax. We find it probably difficult for those people to have implants. Apart from that, in general, most of the people, if they're well controlled, they can have an implant. Even people, if they are smokers or whatever, nowadays the new data shows that, like diabetes or other problem, can still have implants. Nowadays implant is suitable for most of the population with success. When we do an implant, apart from screening the patients, that is to say, to see his medical conditions and making sure that he doesn't have really contraindication to implants. The second thing is that we send him for an X-ray, and the X-rays, which is considered as the standard, is to say, take a cone beam X-ray. Basically, it's like a scanning the bone in there to see three-dimensionally the size of the bone, width and height. Now, if we find that the patient have lost a lot of amount of bone, there are of course many ways that we can increase the size of bone, or we call it like bone grafting or augmentation of the bone. Sometimes we might do some procedures like right at the back and the top jaw, which is called sinus lift. So there are ways that we can build up the bone. However, it just require more time and require a bit more cooperation from the patient as well. But in most of the cases nowadays, the patient really wants implants. There is a lot of ways that we can build up what's been lost within time, and we still successfully put an implant in there. The most important thing is actually taking that cone beam x-rays to find out how much bone we have. And then we can explain to the patient, because I believe educating the patient is very important to know how we can go around it, and is he willing to go through, because as I said, it takes a bit of cooperation from the patients to understand the case, and then it's a matter of planning afterwards.